An electrophysiology study, or an EP study, is a test used to evaluate your heart's electrical system and to check for abnormal heart rhythms. If your heart's electrical system is not working well, whether it's too fast or too slow, you may need a cardiac implanted device to help with either of these problems. Your doctor has ordered this test and you will come to the Kelowna General Hospital to have it done. If you feel unwell while waiting for your procedure, please contact your family doctor. Before the day of your test, you will receive several phone calls. The electrophysiology coordinator, or EP coordinator, and the heart rhythm clerk will be calling you and asking you lots of questions to make sure you are ready for the test.
October 27th, your arrival time is 7 a.m.
The EP coordinator will call you about 2 weeks before your procedure at the scheduled date provided to review all the information that you will need to know to prepare for your upcoming procedure. You will be sent an email with patient instructions and other helpful information about your procedure. Please read it prior to your phone call with the EP coordinator. Please also have the included medication list filled out with your current medications prior to your scheduled phone call with the EP coordinator. The EP coordinator can answer any additional questions you may have about your upcoming procedure at this time. You will also receive a phone call the night before your procedure from an EP nurse to go over any last-minute details for your procedure. Welcome. My name is Cam, and I will guide you through your journey. When entering the hospital, you will come to the waiting area at the Red Heart. Maps and parking details are in the Electrophysiology Studies and Cardiac Ablation Guidebook. A nurse will meet you at the Red Heart and bring you into the preparation area. We will then check you in, which will include taking your weight, checking your blood pressure and vital signs, reviewing your medications, shaving your chest, back, and groin as necessary. After this, there will be many other people who will come and talk to you. A cardio tech will take an ECG, an anesthesia assistant will put in your IV, the anesthesiologist will complete their assessment, and then the electrophysiology doctor will come and see you. The doctor will discuss your procedure, including the risks and benefits.
Now, is there anything specific you would like to go over?
And this is a great time to ask any final questions and discuss any concerns you have before your procedure. Once these steps are complete, you are ready to go. Now you are in the electrophysiology lab. There will be the electrophysiology doctor to do your test. The anesthesiologist will give you sedation to help you relax or go to sleep, depending on your procedure. There will be nurses to help get you ready and assist the doctor. There will be a technologist to work the machinery. And after your procedure is complete, you will be wheeled on a stretcher back to the recovery room where you started. Your nurse will connect you to a heart monitor, get another blood pressure, and complete a brief assessment with you. It is expected that you may be drowsy as you wake up from your medications. Do not worry, we will assess and monitor you frequently.
Yeah, procedure went very well. Your anatomy was straightforward, no surprises. We had very good results. The leads went in nicely with good numbers, good parameters, no issues or complications. So everything went well.
Oh, good.
Good.
The nurses will frequently check your wound site, your vital signs. You will need to stay in bed for about 1 hour after your procedure and not lift your operative arm above your head. You will be allowed a drink and a snack immediately after, as long as you are not drowsy or feeling unwell. Once you have spent an hour resting, your nurse will help get you to sit up at the edge of the bed and go for a short walk. You will then be taken for a chest x-ray. After that, the pacer tech will come and check your device before you leave. Sometimes this will be done the following morning. Once your family member arrives, your nurse will teach you and your family member what is normal and what to expect. Also, review what complications could possibly arise. If you have had an AV node ablation in addition to your new cardiac device, you will be admitted to the hospital for 1 night of observation before you can go home. For the next 24 hours, do not drink alcohol or take any sleeping medication, and do not make any important decisions or sign legal documents. You will not be allowed to drive for at least 1 week and possibly longer based on your unique situation. You will be given specific driving restrictions after your procedure. These are some of the things you should expect when you go home. You will need to be careful with the operative arm for 24 hours and then resume light tasks. For 6 weeks, do not raise your elbow above your shoulder, lift heavy objects, or perform repetitive movements like swimming, golf, or tennis. You are able to resume a normal diet right away. Your surgical dressing should stay on for 3 to 5 days according to the directions from your doctor, and afterwards it can be left open to the air. Underneath the dressing, there will be small pieces of tape called steri-strips. These can stay on until they fall off on their own, which usually takes about 7 to 10 days. Your incision will be stitched closed, and the stitches will dissolve on their own. Please monitor your incision for signs of infection, such as redness, warmth, swelling, discharge, or a bad smell coming from the incision, or if you develop a fever. If any of these symptoms occur, please see your family doctor. Please resume your medications as directed. This will be written on your discharge sheet. The device clinic will call you to book further device checks. Your nurse will indicate if you need any other follow-up appointments. You will need to arrange a follow-up appointment with your family doctor in about 1 week. Remote monitoring of your cardiac implanted device is an option. However, any changes to your device will need to be made in person. You can discuss remote monitoring options with your cardiac device clinic. Do not place magnets near your cardiac implanted device. Keep magnets at least 6 inches from the battery. Never put a cell phone in the pocket over your device. Walk through anti-theft detectors at a normal pace. Do not remain in or near the system for any length of time. The electromagnetic fields can temporarily affect your pacemaker. Keep the following appliances at least 6 inches away from your device. Handheld electric kitchen appliances, such as mixers and knives, electric toothbrush charging bases, electric shavers, exercise bikes and treadmills, handheld hair dryers, stereo speakers, vacuums, sewing machines, and radio-controlled items, including the antenna. You should stay at least 12 inches or 1 foot away from the following: electric fences, vehicle ignition systems, green electrical transformer boxes found outside, car battery chargers, generators of 20 kilowatts or less, uninterrupted power sources, and gasoline-powered tools like chainsaws, lawnmowers, weed trimmers, and snowblowers. Please keep the following items at least 24 inches or 2 feet away from your generator: induction cooktops, jumper cables, bench-mounted or freestanding power tools with 400 horsepower motors or less, example like air compressors, drill presses, grinders, pressure washers, table saws, and welding equipment with currents under 160 amps. Do not use TENS machines, magnetic mattresses or pillows, muscle stimulators, and stay away from large magnets such as the ones found on cranes or in junkyards to lift cars. If you work in any high voltage areas, talk to your doctor or pacemaker clinic. High voltage is found around things like arc welders, smelting furnaces, radio and television towers, and hydro and radio stations. Tell others that you have a cardiac implanted device at the hospital. You are given a temporary pacemaker identification card describing what type of pacemaker you have. Always carry this ID with you. The company that made your pacemaker will mail you a permanent pacemaker identification card in about 4 to 8 weeks after your procedure. Always tell your dentist, physiotherapist, massage therapist, and chiropractor that you have a pacemaker. They might need to take special precautions before starting certain medical procedures or therapies. We hope you have a smooth and restful recovery from your cardiac implanted device.